So this is work that was initiated at the NIH with Dr. Danny Reich. Dr. Luzzi and myself were both part of the lab as of 2 years ago. And so we started the study with the idea of, okay, so we have an idea of what the baseline proportion of CVS positive are in patients' brain. We can classify them as MS, non-MS. But if we focus solely on the MS, and then we follow them over time, what is the likelihood of new lesion forming in the brain with the central vein sign? And does it tell us anything about the phenotype of these patients, right? So what we discover after following for 3 years patients enrolled through the NIH natural history cohort is that patients that tend to form, the patients that are more likely to form CVS positive lesion, new CVS positive lesion, tend to be younger and tend to have a higher CVS positive rate at baseline, which tells us this is closely related to disease activity and inflammatory disease part of it, which is no surprise because we knew that the central vein sign is an inflammatory marker in itself. So it confirms that this is a valuable biomarker to capture MS disease activity, and also potentially, I think, to differentiate comorbidities that might be happening in older cohorts. And that really is a powerful tool in terms of disease monitoring, where you're dealing potentially with cohorts of patients in your clinic that might have new brain lesions without any clinical manifestation, and you're wondering, should I treat this or should I wait? Well, if you look at the CVS positive sign, it might tell you if it's really related to MS and you should be concerned about disease activity that's still silent clinically, or it's just not related to MS, and this could just be comorbidities due to hypertension or just simply aging, and therefore you should not worry about changing DMTs. But that's future work for us to do, and that's where I'm connecting back to the MS-REP study. These are the type of questions we want to investigate on the longer term.